The claim I'm responding to was by Sarah, who said that declawing the cats causes higher incidences of behavioral problems in the feline population. So declawing the cat is basically amputating a bone connected to the claw so that it does not grow back. Her secondary claims were one, that declawing causes chronic pain, and two, that this pain leads to behavior issues. So the advocate's first claim was that declawing causes pain to cats. However, the advocate did not provide enough evidence to support her claim. She also did not mention how long this pain lasts or how this pain is even measured. I found that cosmetic declawing heals relatively fast, usually within a week. And in the long run, that this is beneficial for the family getting the cat declawed, since the cat will no longer tear furniture or hurt young kids around the house. Other reasons for medically declawing a cat are, according to Sandy Eckstein, a cat must be declawed if the claw is damaged beyond repair or has a tumor. Sometimes it's also trauma for owners because immune systems are suppressed, or elderly having blood thinners who cannot be exposed to the bacteria on the cat's claws. Also, the advocate failed to mention that there are several methods of declawing. One is Rescue Clipper. According to a Vet Info website, in Rescue Clipper method, the cat's toe is amputated and the device cuts off everything in just one cut. However, after the operation, the cat needs to avoid clay and sand litter to keep it from getting infected. The downfall to this method is that if the entire bone is not removed, the claw will grow again and a second surgery is needed. The second method is disarticulation, in which a scalpel is used to remove ligaments and tendons holding a bone in one place. Afterwards, the bone is cut and an incision is sewn or glued shut. The cat does need to wear bandages around the paw to aid healing and to keep the germs away. After the surgery, just like the Rescue Clipper method, the sand and clay litter must be avoided to prevent infection. And the cat will lose some control in the foot, which can affect walking or standing. The last one is laser declawing, in which a laser severs the tendons and ligaments before removing the bone, and there is absolutely no risk of the nails growing back. The laser cauterizes the incision during each cut so it does not cause bleeding, and the cat does not have to wear any bandages afterwards, which means that this method does not limit the cat's movements post-surgery, since there is little to no pain. So as we can see, the advocate did not provide information on the various methods of declawing. With the laser method, the cats are up and about the very next day because there is no bleeding or the need of bandages, whereas the Rescue Clipper and disarticulation takes about a week and causes long-term effect, the possibility of infection, and even possibly a second surgery. The advocate's second claim was that the pain caused by declawing leads to behavior issues in cats to appear post-surgery. She claimed that the cats lashed out at the other animals in the house or even at owners. However, not much evidence or any testimonies were provided. Seattle J. First and James Hall from University of Washington Psychology Department said that they found no significant correlation between declawing cats and any biting behavior. I also found testimonies of cat owners who share a similar story. Jennifer Soloway, an owner of 2 cats who were declawed at a very young age, said the cats do not know they've been declawed, and they post-surgery they make the same kneading movements. The recovery process was extremely short and they never showed any signs of pain. Another testimony is from Sharon Callender, who also owns 2 cats, said that she does not object to declawing because both of her cats were declawed because of the family having wood in the house, so they did not want the cats to claw up the woodwork once they moved. The owner also said that neither cat had any problems, and the cats still go outside, catch birds, so it hasn't stopped them from as far as protecting or prowling, and they can still hunt. As for her decision to have the cats declawed, she is very happy with it and it did not affect the cats or their daily behavior at all. The advocate, ultimately for the second claim, the advocate failed to provide testimonies or evidence suggesting the cats are indeed in pain do cause behavior issues. However, the testimonies I provided from cat owners suggest that cats do not have any behavior problems due to pain after the surgery. In conclusion, the advocate fails to provide enough evidence on her two claims, which were decline causes pain and second, this pain leads to behavior problems. The advocate did not provide enough reliable sources or testimonies from vets or cat owners, and thus her argument that decline causes higher instances of behavior problems is invalid. Thank you.
All right, well, you summarized the advocate's argument pretty clearly. There were 2 points that they were dealing with. Your first point is all about whether or not there is pain as a result of declawing. Your suggestion is that there are multiple methods of declawing. I assume that one of the reasons that you're making that argument is that those methods produce different levels of pain or problems for cats. And when you get to that third one, which is laser declawing, you suggest that there really is no pain and no consequence to that. So in essence, there isn't any reason that cats would have to have pain from being declawed. That's the premise of the advocate's argument, and if there is no pain, then there's not really going, if there's no pain from the declawing, then we don't have the problem. I thought you had some pretty good information on that third point, suggesting that there isn't really much impact, although it sounds like all the information comes from the same source, which is vaguely described at the beginning. It would be better if they were direct quotes and you were more specific, like you were in your second point. I would have appreciated that a little bit more, especially on that third thing concerning the laser, or the third technique, the laser declawing. On the second point, you challenged the advocate's lack of evidence on the relationship between these 2 points, which I thought was okay, that there is in fact some reason to believe that their evidence was insufficient to reach this particular conclusion. You basically said they don't provide any examples or statistical information, and I think that that's a good challenge to make. You do provide an authority, a couple of authorities who have written an article that suggests that there's no sign that these kinds of things, the cats who have been declawed are in any more discomfort than any other animals, and they see no relationship between declawing and biting, for instance. You kind of give a justification up at the beginning of the speech about why people might need to do declawing, and it's not simply, convenience. There are practical issues for keeping a pet in the home, and I think that when you come down to it, the notion that there has to be a balance between these risks, and especially if we don't know that declawing causes any pain, especially if it's being done with this laser approach, it seems like the risk is incredibly minimal. And then you've got examples that suggest that there weren't any problems. So I don't remember how we can, if we were hearing the speech immediately next to the previous speaker, it would be a little bit easier to compare the kinds of evidence that the advocate presented to the evidence that you presented. But what you presented, I think, is definitely responsive to that point. All right. Thank you.